examples, but also the pace of change has been pretty relentless when you look at what's needed to have been delivered to get us to the position of this end of year. So I just wanted to make sure from a chief executive point of view that I really drew attention to the effort and the dedication, and how I recognise there's more for us to do, but we've done really well, and I'm really proud of the organisation's efforts and how much we have achieved over the last year. I think it's a credit to everyone. Thanks.
Thanks, and perhaps I can just add to that, if I may. Your question is really key, Jen. Certainly in my engagement with the cabinet secretary and his officials and so on within Welsh Government, there is often an opportunity to highlight, if you like, what's going really well, as well as, of course, properly and legitimately responding to the ongoing difficulties and challenges that we need to resolve and that we need to recover from. So, I echo everything that Nicola and Hayley have said. Is there anything you want to come back and comment on, Jen? Okay, thank you. We are asked to receive the Q4 report and take assurance that there is a process in place for monitoring progress against our plan. And also, we are asked to note the reports, that the report also acts as the annual summary of progress against wellbeing objectives under our requirements in the Wellbeing of Future Generations Act. Once again, please indicate if you have a comment or if you would like to indicate you don't support the recommendation. That therefore is also supported unanimously. We now invite Helen to come back in and to present the risk management papers under item 3.4 of our agenda. Thank you, Helen.
Thank you very much, Carl. So I'm delighted to provide you with three documents today. That's the risk management framework, the board assurance framework, and the board's risk appetite statement. And all three of these are board retained approvals or considerations, not delegated out anywhere else. So I'll just make a couple of comments, if I may. Firstly, on the risk management framework and the board assurance framework, you'll see from the paper that it's been considered by both the Executive Committee and the Audit, Risk and Assurance Committee, both of which added some value and have strengthened the documents as you see presented to you today. Key changes, so we wanted to review these in line with the review dates to make sure that they remain fit for purpose in the context of our organisational systems, structures and processes. We also had some feedback from Audit Wales in our structured assessment that the read across both of these documents needed to be stronger, and that was in part because we developed them a year apart. So we've now ensured that they talk to each other more comprehensively, and of course we wanted to make sure that they remain in alignment with risk management and assurance guidance as well. In terms of external or third line defence assurance for you, internal audit have reviewed our risk management and board assurance frameworks. We received an overall reasonable assurance as expected in relation to that, although the board assurance framework was a substantial assurance. And in our structured assessment, Audit Wales have recognised the progressive and maturing work that we are undertaking, recognising that there is always more to do. So I think in summary, I think we've developed our frameworks and processes. We've embedded this now throughout a large part of the organisation and at board and committee level. I think we've made sure that the BAF and risk is very clearly embedded in board and committee culture, but also in the way in which we report and interrogate and scrutinise the reports and documents that we have. In terms of the risk appetite statement, this is reviewed annually by the board. We discussed it collectively in board development, and then audit and risk have also reviewed it as well. There are no significant recommended changes to any of the appetite level descriptors this year. Board members may recall that we undertook quite a comprehensive review and made some quite significant changes 12 months ago. We have, though, recommended that the board kind of accept an overarching organisational risk appetite. I think that's in light of our complex pressures and environment that we're operating in, both locally in Powys, but also nationally and internationally from an economic perspective as well. So the recommendation is that we essentially start with an open appetite to risk, with the exception of quality and safety. That presents us with a positioning statement to start off with. We then apply each individual category as we would ordinarily do. And I think it's important as well just to recognise that the appetite is about risk, but it's also about opportunity, and we need to apply it appropriately in both of those contexts as well. So in summary, in terms of the next steps, I think we will need to continue to embed all of our risk and board assurance frameworks. We've done a lot of that, but there will always be more to do across the organisation, which includes the training and support of our staff. We will want to make sure that we explicitly articulate more about risk and assurance gaps in our board papers. That's also a work in progress, and we'll continue to do that. And we will want to ensure that we continue to prioritise our board and committee agendas in the context of our risk, strategic risk, but also our appetite statements as well. So very much welcome any comments or feedback, Carl. Thank you.
Thank you, Helen. And just in case, just whilst people are considering whether they want to ask a question or consider a comment, as you say, Helen, these papers were considered in some detail by our Audit, Risk and Assurance Committee at its meeting on the 12th of May. So I will just ask Steve, as chair of that committee, whether, Steve, you have any assurance observations that you want to make from the perspective of your committee, please.
Yeah, thank you, Chair, and thank you, Helen, for that summary. And just to confirm that, you know, we had a good discussion at the meeting last week. There were some discussions. I think it's a bit of a theme of the meeting today about how we evidence and measure impact from, you know, these frameworks. But the committee recognises the significant work that's been undertaken by the corporate governance team and throughout the organisation to embed the new approach to risk management. There are some good examples of how risk management is driving action within the organisation. For example, in terms of digital risk, we had a deep dive recently in our in-committee session in ARAC, and you know, as a consequence of the focus on risk, I understand that there is a review of business continuity plans being undertaken. We've also, you know, as the board and the Finance and Performance Committee are aware, have done extensive review of the risks around finance driven by the risks there. So I think there's good evidence that these frameworks are really driving change and helping to drive change throughout the organisation. But the committee were happy to recommend these for approval by the board. Thank you.
Thank you, Steve. Hayley, please.
Yeah, thank you. I think it's certainly a point of substantial discussion that we have in the executive team around how we're making sure that risk is managed across and over the whole organisation. And clearly, we've done a lot of work in this space, and it continues to be a focus about how we embed that. Just to give you some reassurance around the leadership arrangements we've got around risk, with a very clear risk ownership, and also the particular work that the team have been developing to offer the right tools for staff in implementing the risk management framework. We've mentioned the toolkit, but also just that continuous discussion and support. And we spend quite a bit of time in executive committee discussing around how we moderate risks across the whole organisation. So just some assurance about how the focus on how we embed this further and how it needs to continue to mature is something that we're very focused on as a team. Thanks.
Thank you, Hayley. So we'll move to the recommendation against this agenda item, which is that we approve the revised 005 risk management framework, the 014 board assurance framework, and we also approve the revised board's risk appetite statement. So once again, an opportunity for anyone to comment or indicate they don't support the recommendation. That therefore is also supported unanimously. We're staying with you, Helen, for item 3.5, which is your report as Director of Corporate Governance. Thank you.
Thanks very much, Carl. So the Director of Corporate Governance report is an eclectic mix, but all related to board and committee assurance and asks of you. So just a brief introduction from myself. As usual, we provide an overview of board-related activity since the last meeting, including anything that's been taken in the in-committee parts of board meetings as well. Carl, with your leadership, we have reviewed board committee membership, including the role of chairs and vice chairs, and we've presented that and ask you as a board to ratify that. With thanks to all of the committee chairs, but also the committee members themselves, as well as lead executives, we've reviewed the presented committee terms of reference. They've all been reviewed by each individual committee, and the summary presented, as well as the link to the full documents should you wish to see them. The board work programme, as is the case for the committee work programmes, these are put in place on a rolling annual basis. They take into effect or into consideration, a number of areas, including the board's terms of reference and requirements under the standing orders, including any escalated items, any risks, and any kind of wider environmental factors that we're aware of. So the work programme will, of course, change. We will flex as we need to throughout the year, but at this point in time, important that the board are content with it, should you be. And then finally, presented the board and committee effectiveness overview. You'll see that the board questionnaire is currently being analysed, and we'll report that back as a future meeting. There are some other parts of the report, Carl, but they're the key bits I wanted to draw out. Thank you.
Thank you, Helen. Colleagues, please indicate if you have a question or a comment in response to Helen's report. Yes, please come in, Ian.
Yeah, thanks, Chair. Ian Thomas, independent member. Helen, thanks for the report. And, you know, there's a lot of ambition in what we do. It's a very thorough governance structure, and you know, you know, all to be commended for that. And I thank you and the team, obviously, for your work in helping us navigate it, because it can sometimes be complex. My question really is about external benchmarking. Knowing the kind of the quality of the things we do, is there any kind of external reference group that you work with where you can benchmark what you're doing at Powys compared to where other health boards are, which will also incorporate where we can pick up other elements of perhaps best practice? I'm not saying what we don't do is best practice. We might be teaching other people, I don't know. But I just wondered what kind of external framework you might be working in to give us that extra bit of assurance that we can be benchmarked externally. Thank you.
Thank you. Should we just go to Simon as well, Helen, please, and take his question or comment? Thanks, Simon.
Thanks, Carl. It's just really with respect to the sort of forward 26-27 work programme, and just reflecting back on some of the focus we've given ourselves around commissioned services, it being a large proportion of our budgetary spend, a significant part of our service delivery to our population, and something we know we are needing to give focus on following the Grant Thornton work. I am aware that quite a lot of that is spread out and is in existing activities and will feature most likely in parts of individual agendas. I just wonder if there's any places or spaces in our forward work programme where it might be helpful and sensible for us to give specific attention to pull all of that together to give us a sense of the sum of the parts, really, in terms of how are we dealing with the Commission services challenge overall and piece. It features, and I'll probably speak again about it in terms of the next agenda item, in terms of the PECS agenda, but I just wonder in terms of some of our forward planning whether that's something we might want to flex and give some thought to as well. Thank you.
Thank you. Thanks, Carl. Thank you, Simon and Ian, for the questions. Really welcome. Simon, I'll just come to yours first, because I'm going to, I'll just put on notice either Paul or Nick may wish to come in and comment on those, because I think some of that is about the work Paul is leading, and you're absolutely right, it relates to the next item on patient experience, but also some of the work Nick has been leading around the strategic commissioning framework as well. So I'll maybe just invite those in a second, if that's okay. Ian, thank you very much for the question on benchmarking. I guess a few things to respond, really. So part of our benchmarking, I think comes through some of the external audit work that's undertaken through the structured assessment report that we have from Audit Wales. That's supported by our internal audit and various other bits that I know you're very aware of. We have a very active peer group across NHS Wales. There's a number of them, but certainly in corporate governance, we meet on a monthly basis. It's a very supportive group, but also it's a very helpful group in terms of sharing, discussing, and nearly every day there's something that's being shared or added to, or value being added. So not benchmarking as such, but certainly understanding what's going on across Wales and where value can be added. So, you know, as an example, we've shared this week the way in which we take items in committee and the protocol that we have around that with some other health boards, as an example. I think more broadly, we've got our professional membership, and we look to corporate governance institutes that kind of help us with that. And over the last 2 years particularly, I think in the Chair, CEO and Corporate Governance Forum, Audit Wales have also been providing a bit more of an overview of where aspects of national good practice are in corporate governance terms. So that kind of allows all of us to have a bit of an opportunity to look in, but also share and reflect some of that learning. So some of that's more formalised benchmarking, some of it is more informal sharing of good practice, but certainly those mechanisms are all in place. So hope that gives you a bit of reassurance on that. And Carl, I'll look to Paul and Nick to just add to Simon's question, if that's okay.
Mm-hmm.
Hi, thanks Helen, and thanks Simon for the question. I wasn't going to address directly around the quality and patient safety aspect in this space and wait for the next agenda item if it might fit better there, but I'm happy to speak to it here equally, but on a broader sense, and I'm sure Nick will want to come in on this piece around the piece of work we're doing around the target operating model for commissioning and some of the work that's going on there that brings the whole thing together in a kind of way that you were describing. But I'll bring Nick in on that if that's okay. Happily address the other item in the next agenda item.
Thank you. Thank you for the question, Simon. So I think it's important to note the strategic commissioning framework does what it says on the tin. So it sets out the approach and is a framework for the approach we want to take on commissioning. The sort of delivery actions directly that we chose to take forward in 26-27 underneath that heading are outlined in the annual plan, and therefore come through the quarterly monitoring reports to board. It is really important to note as well that Better Together is our transformation programme of all our responsibilities that aligned to the scope of that transformation programme and the programmes of work. So that, for example, the Plan Care programme will very much be driving the GIRFT review, which is obviously on a pathway basis across our provider and commission services. Similarly, the community model, absolutely looking at what we can do in our community model, which will also affect pathways into our commission services. Both those two programmes particularly are absolutely linked to our savings plans as well, and the actions outlined in the annual plan. So I think it's really, so we do talk about commissioning transformation under the banner of Better Together, and really important to know that's not just about beds and hospitals and our provider staff, it is that pathway lens. Having said that, I think maybe part of your question is maybe that's not visible, how, you know, what the map of delivering the strategic commissioning framework is through our various mechanisms, and maybe something we can think about sort of drawing that up in some way. We've got 3 pieces of work as well, because there's also how we commission as a practice, as a mindset, as a framework as a approach to making change happen, which in its truest form is what it is, and gaining better value for every pound we spend. So Grant Thornton, as a follow-on to their reports, that are supporting us as a health board to develop our target operating model for commissioning using the strategic commissioning framework as the framework for that, and the Powys Teaching and Health Board commissioning cycle. And that is a really intense piece of work that's going on now, started yesterday, due for completion by the end of June. So again, things that we will need to brief the board on, but discuss with the boards as well as we go forward. There may need to be choices that we'll need to make in that in terms of phasing and where we want to get to and by when, all of those things, not for discussion today. But yeah, really important and interesting piece of work. Brings us back round to some of the things that I expect to be picking up into the quality report: population health, evidence, patient outcomes. Those are the grounding of commissioning practice. So thank you.
Thank you, Nicola.
Helen, back to you. Simon, I don't want to put words in your mouth, but I think what I took from Simon's question, Helen, particularly on the commissioning stuff, is, does it feature clearly enough in the work programs of our committees and so on? Is that something that you think, well, I think Nicola was suggesting, wasn't she, that it's something that we might want to look at?
Yeah, absolutely, Carl. We'll take a board action on that, just to go away and review, if that's okay, because I think Nick's absolutely right. It's kind of dotted across lots and lots of areas of work, as it should be. I think it's how we paint a cohesive picture of where that comes together, and what of that is at board level and what is it that's in committees. So if it's okay, Nick and I'll take an action and we'll go away and work on that.
Yeah, that would be helpful. Thank you.
Carl, if I may, just in closing, I just wanted to just make a big thank you, really. All of the work that I've presented today, thank you to my team, of course, but this is a significant effort across the entire independent member group and committee chairs particularly, but also executive leads and colleagues. So just a big thank you for the team effort in bringing it together. Thank you.
Yeah, and once again, absolutely echo that, Helen. We received the Director of Corporate Governance report. We're asked to ratify the board committee membership for 26-27, to approve the changes to the board committee's terms of reference, to approve the board's annual work programme for 26-27, noting that it may change in response to business need through the year. We take assurance that the committee annual work programmes are in place, notwithstanding the action that we've just agreed around looking at the sightedness of commissioning. We also take assurance that the board and committee effectiveness reviews have been undertaken for 25-26, and we note the update provided in relation to the Health Board's petitions protocol. Usual ask, colleagues, please come in if you want to make a comment or if you want to indicate that you don't support the recommendation. That therefore is supported again unanimously. And so that brings us to item 3.6. We're back with Paul. Just for public awareness, really, we spent a considerable chunk of time in a recent board development session led by Paul and colleagues on the new listening to people framework. So, we had that informal time learning and discussing its implications for us. And so we're in your hands now, Paul, in terms of the formal submission to this board meeting. Thank you.
Thanks very much, Carol. I was going to take the paper as read, Carol, in the interest of time, and move to questions. But prior to that, I just wanted to give assurance around that we have fully implemented the new listening to people framework since the 1st of April, and we're making good progress in embedding the operational model around that. And of course, that ongoing embedding of the model over the next couple of weeks to the end of May, and then its implementation and performance against it will be regularly, I'll be regularly updating PECs on that in the coming weeks and months.
Thank you, Paul. So we take the paper as read, and Ian, please come in.
Yeah, thanks, Chair. Paul, thanks for the paper. And I appreciate what I'm going to ask you. I've asked you before, but I think given, that the public Powys can access this meeting. I think this is an important question to ask, I think, publicly. The question is quite a straightforward one. Obviously, we have this, but we also have, Llais, and we have a number of other organisations around us that hold us to account publicly. And I just wanted to kind of check in with you really about how you triangulate everything to make sure, one, that the public is assured that they are listened to and that the voices can get through both in this, and how you may triangulate with an organisation like Llais. Thank you.
Yeah, thank you very much, Ian, and a very important question. And you're right. We have a number of ways that our residents of Powys can make contact with us and raise concerns and questions. Obviously, they can do that through the new Listening to People framework now, and equally, we will get questions raised through public representation, public representatives, and we'll also get questions coming through Klaus and others. Within our integrated quality report, we pull all of that together, and you will have seen in our new report to PECS, a big part of that, pulling it together around our patient experience and what we're hearing from that, what we're getting back from our listening to people raising concerns and issues, and equally what we're getting in from Klaus and others. We pull into our integrated report, and from that, we triangulate the information we're getting and identify learning and improvements that we need to make, and go back to our patient experience framework that will be embedded by September, how we then feed that back to the public to give them the assurance that we are listening and we're taking action.
Yes, thank you. Thank you.
Jen, please.
Yeah, mine's a comment. Carl, you said at the beginning of this item that we did discuss this and really dig deep into this item at our board development. I really welcome that, Paul, and really thank you for that. I just want to reaffirm that one of the comments I made there was about that I see this as an opportunity for our staff in terms of our workforce development opportunities. This is a new sort of a development on our culture, how we're going to be conducting ourselves in order to address and meet the needs of this framework. And I see there are real opportunities for our staff to develop and expand their skill set in being able to do that. And I see that as a real opportunity. So I think that's something to celebrate too. So look forward to hearing more about that. But thank you.
Thank you.
Simon.
Thank you, Chair. And to come back to that commissioning question, really, Paul, I just note in the paper it's the only reference I found to commissioning is a sort of local implementation update section and talking about the workforce capability and considerations such as commissioning concerns. Could you say a little bit more? I'm seeking a bit more, I think, assurance around how does it work in the commissioning context.
Yeah, and I can go a bit broader on this as well, Sammy, if it's helpful. I think in leading up to the 1st of April, in terms of our current practice, to that point, we would get concerns or complaints or issues raised into Powys through whatever route around our commissioning services. And we would then use that information to engage with our commission services, raise a concern with them and ask for an investigation and an update. And that practice hasn't changed a huge amount. The challenge around listening to people framework is very much a provider-led framework. So around the commissioning arm, the framework is all geared towards the individual who's raising the concern has direct communication and direct interaction with the provider of that service that they're concerned about or have an issue with. So our new role in that is supporting our residents who raise those concerns around how they engage with and get the resolution that they require in a timely manner from a provider service, and we getting feedback from a provider service. So as part of our new framework we're developing around the quality and assurance piece for commission services, that will play a big role in getting the assurance back from provider. I think the other slight challenge we have is for our commission services within Wales, they'll have to follow the Listening to People framework and work to those timelines. For our commission services over the border in England, it works slightly different, but we will still try and hold them to account on the timelines that have been set within the Listening to People framework. And how we engage with that will really determine the next phase of our maturing journey around getting overall assurance around our quality and patient safety interactions within our commission services. So the framework we're developing at the moment, and Nick referenced earlier the piece of work that we're doing collectively with Grant Thornton, we're developing a framework within that to help us to get a completer picture around assurance around quality and patient safety. So we're going to be setting out key metrics that we will be seeking completion from our providers, and for them to report back where they are on our metrics, and then an escalation and improvement plan where required that will come into, and this will all go back into the PECS report in time once we have that framework done. We did commit to developing that framework and having it in place by July for PECS, and Nick referenced earlier the current piece of work we're hoping to complete in June. So we're going to work hand in glove with our commissioning team and with Graham Thornton around how we develop that broader framework. So we're going to move from a kind of passive seeking information to a more direct getting clear information back in from our providers. Whereas before we would seek information from their board papers, from reports that might come out of CQC or out of HIW, we're going to be far more proactive in that space now in seeking assurance and against key KPIs that we're going to set, which will include the listening to people framework and how people are responding to that.
Thank you, Paul. So I look forward to seeing some of that detail being mapped out in future meetings of PECS and through people's experience framework and so on. Okay, yeah. Thank you, Chair.
Thanks, Simon. We'll go to Mick.
Thanks, Carl. Just in that kind of spirit that Ian raised of, this was a conversation that took place in a private setting. We're now in a public setting, and talking about approving this. What I took away from that conversation was a real kind of commitment across the board, both execs and non-execs, about the principles and the kind of underpinning sentiments that sit within this policy. And we did discuss the risk that we could end up over-promising and under-delivering, which could actually undermine confidence rather than build it. But what I took reassurance from was that there was a kind of real understanding that this is not just about signing up to a policy, but we had to make sure we had the right capacity, the right systems, the right skills, and most importantly, the right culture that underpinned this to actually make it deliver. And Paul, in the way that he described the work that was taking place in the background, provided that kind of reassurance that was the focus we were taking. So just think it's kind of important that that's not missed, that it's not about just signing off a policy. It's not just about shifting from putting things right to a new framework. There is a kind of real underpinning, shift in the way that we deal with complaints, which is necessary.
Yeah, if it's all right, Carl, I'll just come back on that point, and it kind of marries well with Jan's point earlier around this is a cultural shift for us as an organisation and for us as a country in terms of Wales and how they deal with this. But for our organisation, we really want to move to a much more proactive listening conversation and early resolution. And that requires a certain skill set and a certain mindset and culture that, as you rightly reference, we're working on behind the scenes. And there's a lot of support and education going in to support our staff around how they manage the listening conversations and the early resolution in the first instance. That so our residents who raise concerns and complaints and issues around the services they're receiving, both as a provider and a commissioner lens, they get the resolution they're seeking, and it isn't protracted and it isn't defensive. And that's really, really important for us.
Thank you. I can't see anyone else wishing to come in. So thank you to all. And thank you, Paul, to you and your team for leading and implementing this important improvement in the way in which we operate. We are asked as a board to ratify the All Wales Listening to People framework as our health board's mechanism for dealing with complaints, incidents, and as a redress process. So usual request, colleagues, if you want to speak to the recommendation or dissent from it, please indicate. Therefore, that is supported and approved unanimously. In which case we turn to item 3.7 on our agenda, where we consider the minutes of our previous meeting held on the 25th of March. For accuracy, would anyone like to suggest any corrections or changes to the version of the minutes that are here for our consideration? Therefore, we approve those minutes as a correct record. There are a number of items, 6 items in all, under our consent agenda, and as I have explained earlier in the meeting, we take those en bloc, and we take assurance, or we approve the various recommendations and so on associated with those papers without discussion. I'm not aware of any other business that needs our attention today, so I will assume that there is none, in which case that brings us to the end of this meeting and to the close of this particular meeting of Powys Teaching Health Board. It just remains for me to thank everyone who has contributed to the meeting, for those behind the scenes whose hard work has prepared for this meeting and helped the meeting to flow so smoothly. A big thank you. We next meet on the 24th of June, again online via the Teams platform as today. After our lunch break, we will be meeting for a brief in-committee meeting, and therefore, in order to enable that to happen, I want to put to you as a board that I, with advice from the Director of Corporate Governance, have determined that the following items include confidential or commercially sensitive information which is not in the public interest to discuss in an open meeting at this time. Therefore, you as a board are asked to take this advice into account when considering the following motion to exclude the public from this meeting from this part of the meeting. And this motion is taken from section 1.2 of the Public Bodies Admission to Meetings Act 1960. And the motion is that representatives of the press and other members of the public shall be excluded from the remainder of this meeting, having regard to the confidential nature of the business to be transacted, publicity on which would be prejudicial to the public interest. Does anybody want to not support or not adopt that motion? That therefore is adopted and enables us to meet in committee after our lunch break. So we'll take 30 minutes for lunch. And if I could ask then that we start our in-committee meeting, please, at 13:35. See you then. Thank you very much.